So good evening all of you and welcome to Unacademy. So today in this half an hour session we'll discuss the 10 image based question in dermatology. So welcome everyone. Please give me a thumbs up if my audio and video is clear to you. Please give me a thumbs up. Now in the series of Das Ka Dam, we have already done the discussion of 10 match the following questions in dermatology, 10 assertion and reason questions in dermatology, and the today's session is exclusively on the image based questions in dermatology. So I welcome everyone on Unacademy Learning app and Unacademy platform. Little bit of my introduction. I am Dr. Chesta Agarwal, your dermatology educator on Unacademy, and I have myself scored All India rank 261. So I'll give you the tips and tricks how to do questions in your upcoming exam, that is INI-CET or NEET PG exam. So hello Shakti and Bishwas, welcome to the class. Now little bit about the courses running on Unacademy. So we have recently started a batch course named ACE NEET PG. Now in this batch course we are mainly discussing the previous year MCQs related to all the 19 subjects. Now as you all know that in the end you have only 1 or 1.5 months left for your exam. Now the best thing is to start revision, and how to revise a subject by doing their previous year MCQs or number of MCQs. Why? Because there is a high probability of getting the PYQs repeated, and second you will get to know that which is the favorite topic of the examiner. So it is the best time to solve the PYQs, and for that purpose we have introduced the batch course named ACE NEET PG. The batch course have started on 5th of October. So I request everybody, those who are planning to give your NEET PG exams in 2021, please get yourself enrolled into this batch course. Now for the enrollment, you should take Unacademy Plus subscription. And for Unacademy Plus subscription, the cost of 1 month subscription is around 4,500. Now if you use my referral code, that is Chesta10, you will get additional 10% discount on the subscription cost. So you can go for 1 month or 3 months if you are planning to give your NEET PG 2021. Now if you are preparing for the next year exam, that is 2022 or so on, 2022 or 23, then please go with Iconic subscription. Now what is the difference in Iconic subscription and Plus subscription? In Plus subscription you have access only to Unacademy, but in Iconic subscription you have access to Unacademy as well as Prep Ladder. So you can access the live classes of Unacademy, and side by side you can also access the recorded video lectures of Prep Ladder as well as question bank of Prep Ladder. So this combination is very beneficial for your preparation. The minimum subscription duration is 1 year for Iconic subscription, which is around 4,125 per month. And if you use my referral code Chesta10, you will get additional 10% discount on that. Okay. So yes, Shakti, this class will be useful for FMGE also. Why? Because in FMGE the board is same. NBE sets the paper for FMGE as well as for your NEET PG examination. So this session will be beneficial for all those students preparing for NEET PG, preparing for FMGE as well as INI-CET. Okay. Now an important notice that every day on Unacademy Learning app I take free classes. These classes are specially designed to make you aware that how you will get the new pattern questions in dermatology. On Monday and Tuesday the class is at 9 PM to 9:30 PM, that is of half an hour, and on Wednesday to Sunday it is from 8:30 to 9 PM. So I request everybody to please see these special classes because these are absolutely free, and this will help to prepare and to revise dermatology in a quick and a rapid manner. Now this is another notice that every day at 8 PM on Unacademy Learning app we give you a 20 question series which is specially designed for upcoming NEET PG 2021. Now these questions can be from any topic, any subject. So this will help you guide which subject is weaker for you, which is stronger, and where exactly you lie among all the students who will be giving the upcoming NEET PG exam. Similar to this, we have another session at 9 PM, and this is designed for those who will be giving exam next year. So if you are planning for 2022, go ahead at 9 PM, and if you are planning for 2021, go ahead at 8 PM. These two courses are also free for all of you. So you just have to download the Unacademy Learning app through the App Store. Just select your branch as NEET PG, and from here you can choose whether you want to see the plus course, the free course, or the special classes. If you want to see the plus courses, you have to take Unacademy subscription. You can choose between plus subscription or iconic subscription, and you can choose between the duration for which you need the subscription. In the end, please apply the referral code CHESTA10 for additional 10% discount on the subscription cost. Okay, so this is all about the discussion of the new courses and how to apply for Unacademy. I think now we have many students with us, so I think we should start with the discussion of today's class. So are you all ready? Please give me a thumbs up if you all are ready for the today's first session. Okay, so going ahead with the today's first question. Now this is an image based question. The question asks, or question says that a 2-year-old man had multiple small hypopigmented macules on the upper chest and back for the last 3 months. The macules were circular, they are arranged on around the follicles and may had coalesced to form large sheets. The surface of the macule show fine scales, and he had similar lesion 1 year ago which subsided with the treatment. The most appropriate investigation of choice is. So I'm very sorry because I think I'm coming in front of the picture. I hope you can see it. So please give me a thumbs up if you can read this. Okay, very nice, very nice. I think students can able to see the picture as well. So a 2-year-old man, so what is it? You have to tell me the diagnosis also, and you have to tell me the answer also. Anybody with the diagnosis? Very nice, Bishwas, Gaurav, and very nice, Swarna. The correct answer of this question is option number 1, that is potassium hydroxide. Please remember, potassium hydroxide preparation of scale is used. Can anybody tell me the diagnosis? Very nice. The diagnosis here is pityriasis versicolor. What is pityriasis versicolor? It is a superficial fungal infection which occurs because of a superficial yeast infection. And what is the causative organism of that yeast? It is Malassezia globosa or Malassezia furfur. Now what does it do? This yeast species, it releases 2 types of substance. One is azelaic acid. Now what does this azelaic acid do? It causes dilution of the pigment, leading to hypopigmented macules. So why there is hypopigmentation? It is because of presence of azelaic acid. The next thing is, in these individuals they have pteridine which is formed. So pteridine is responsible for the yellowish color on the wood slump, which is very characteristic of pityriasis versicolor. Another thing which you have to note is, in pityriasis versicolor you tend to see plaques specially present around the peri or around the follicle. So there you have the follicles which are arranged around, or the plaque which is arranged around the follicle, or they have a perifollicular arrangement. And the last point is, if you look at the lesion, you will see fine scales. On scratching these lesions, there is increase in the, or there is accentuation of the scale. And what is this sign called as? This sign is called as Besnier's sign. So please remember, all of them are very important exam question. First of all, the species causing pityriasis versicolor, that is Malassezia globosa. Why you see hypopigmented macule? It is because of release of azelaic acid. What is the location of the plaque or the location of the macule? They are perifollicular in location. And what is the scales occur when you scratch it? It increases in the appearance, and this is called as the Besnier sign. Now if you do, or if you take the scales and if you do the KOH scraping, you will see a characteristic appearance, and that is called as spaghetti or meatball, spaghetti and meatball appearance, or you will see presence of banana and grape appearance. So please remember these appearance. This is very important for your upcoming exam. Okay. Now going ahead with the next question. I hope this is clear to all of you. Now please answer this question. Identify A. So I'll be a little bit in the side. Identify A. It is the histopathology of psoriasis, which is showing the spongiform pustule of cocos. It is histopathology. I think this is not visible, and I am very sorry for this. Ankita, the hypopigmented macules are mainly present over the trunk in case of pityriasis versicolor. Now please try to solve this question. If you are not able to see, I'll just move my location. Just let me know if you can see this image. I'm very sorry about the image because it is not visible. I hope it is visible now. You can see the space now. So please answer the question. It is the histopathology of psoriasis, histopathology of lichen planus, it is a histopathology of dermatitis herpetiformis or erythema multiforme. Very nice. Swarna is already with the answer. What about other students? Okay, so please remember, here I have shown you a histopathology and there are few points, that is orthokeratosis and hypergranulosis which is seen. So Ankita, if you see hypopigmented macules over the face, you have n number of differentials. So depending upon the clinical manifestation given, then only you can answer the question. Okay. So there are many lesions which present with hypopigmentation over the face. For example, pityriasis alba, indeterminate leprosy, vitiligo, anything can present with hypopigmented lesions over the face. Okay. And I think everybody is right here. This is a classical histopathology of lichen planus and the box here shows that it is the Max-Joseph space. Now what are Max-Joseph space? In lichen planus you see basal cell degeneration. Now what happens when there is basal cell degeneration? The basal cell become or they form colloid bodies. These colloid bodies with time get absorbed and when they get absorbed they leave an empty spaces. These empty spaces are called as Max-Joseph space, which is very characteristic of lichen planus. What are the other histopathological features of lichen planus? This is wedge shape hypergranulosis. Wedge shape hypergranulosis. You will have basal cell degeneration. You will have sawtooth appearance of the rete ridges. Sawtooth rete ridges. You have presence of colloid body which is also called as civet body, which is also called as cytoid body. And in the last you will have, when there is a resorption of these bodies, you will have Max-Joseph space. And you will have a thick band of inflammatory infiltrate at the dermoepidermal junction. Band of inflammatory infiltrate at the dermoepidermal junction. So please remember all these points. These are the histopathological characteristic of lichen planus. Now moving ahead to the next question. Please answer this question. A 40-year-old male, I'll just do one thing. Just a second. I'll move this picture on the left hand side a little bit. Just 1 second all of you. I think now it will be visible. Now please answer this question. A 40-year-old patient, known case of Hansen's disease on MDT since 20 days. He had this painful fluctuant swelling over the anterior aspect of the wrist along the course of median nerve. What will be the treatment option here? First, stop MDT. Second, stop oral corticosteroid. Third, oral thalidomide. And the last one is the incision and drainage. So please answer this question. Which is the treatment of choice in this particular case? I hope it is visible now. No confusion. Image is visible. Yeah, very nice. Swarna, you are right. I hope you are answering for this question. What about the answer? Please, can you tell me the answer of this question? Anybody? So please answer this question. So this is a case of Hansen's disease who was started on MDT. Now after starting on MDT, patient developed fluctuant swelling over the anterior aspect of the wrist along the course of the median nerve. So you are right, Vinay, it is a case of lepra reaction type 1. So in lepra reaction type 1, they have shown you that a patient developed this type of swelling which is having fluctuant pain is seen. So what is the answer here? Please remember, whenever you see a case of nerve abscess, always the answer becomes incision and drainage. You will not start corticosteroid because whenever you have abscess anywhere in the body, you have to put a nick and you have to drain it. So this you might have read from your surgery classes that abscess anywhere in the body, it should be drained, otherwise it will not heal. You will start corticosteroid, but the first and the treatment of choice is incision and drainage. So please give me a thumbs up if you understood this point. Doc World, few dollar, Dr. Ankita, did you understand this point? Whenever you see nerve abscess, the treatment of choice becomes incision and drainage. Okay. So I hope this is clear to all of you. Moving ahead to the next question. Now please answer this question. A man aged 30 years presented with following pustular lesions. He has been taking treatment for acne with doxycycline. His other acne lesions like papules comedones subsided with treatment, but these pustules soon developed and were unresponsive to the medication. What is the most probable diagnosis here? Pustular acne, gram-negative folliculitis, perioral dermatitis or pustular rosacea. So please answer this question. So it's a very good question. Please answer this question. Very nice. Okay, so please remember this is a case of gram-negative folliculitis. Now why it is, see, first of all it is a repeat question from AIMS. So there is a high probability this question can get repeated. Now why it is gram-negative folliculitis? Because they have told that a patient is, a known case of acne is taking doxycycline for a longer duration. Now what happens when a patient take antibiotic for a longer duration? There is inhibition or there is loss of the normal commensals of the body. Now when you have loss of the normal commensals, then the pathogenic organism grows over the skin. Here in this case, because of the long-standing doxycycline, patient have started developing the pathogenic organism, that is Klebsiella, which is the gram-negative organism. Because of this gram-negative organism, he started developing these pustular lesions. So they have mentioned that his other lesions, which are acne lesions, have subsided with the treatment. But these pustules are not getting treated with doxycycline because it is the gram-negative organism. So you have to add a gram-negative antibiotic coverage for the treatment of this condition. So this is a clear-cut case of gram-negative folliculitis. It is not a case of pustular acne. Understood this point? This is very important and this is a recent MCQ from AIMS. So there is a high probability that this question gets repeated. Okay. So I think this is clear to everyone. Moving ahead to the next question. Now please answer this question. I hope it is visible or else I'll just move the location so that you can see it clearly. Yes. Now please have a look over this question. The patient suffering from ulcerative colitis presents with ulcer on the anterior leg as shown in the image. Now you have to tell me the diagnosis. Pyoderma gangrenosum, venous ulcer, tubercular ulcer or chancroid. Very nice. So this is a clear-cut case of pyoderma gangrenosum. What is pyoderma gangrenosum? It is a neutrophilic dermatosis. Neutrophilic dermatosis means here you have presence of large number of neutrophils in the skin. What happens in these individuals? You have associated inflammatory bowel disease, that is ulcerative colitis or even Crohn's disease. In this patient, the classical clinical feature is sudden development of painful ulcer which progresses very rapidly. So whenever there is a case with associated or underlying inflammatory bowel disease and the ulcer which is rapidly progressing associated with pain and which has presence of violaceous margin, this is a case of pyoderma gangrenosum. Now can anybody tell me what are the other neutrophilic dermatosis you know of other than pyoderma gangrenosum? So please remember you have total 4 types. One is pyoderma gangrenosum, second is Sweet syndrome, third is Behçet's disease, and the fourth one is neutrophilic eccrine hidradenitis. Neutrophilic eccrine hidradenitis. Now in this there is accumulation or infiltration of the neutrophils in the eccrine gland duct. So I will be telling you this later in the class, but for now just remember that you have 4 types of neutrophilic dermatosis. Pyoderma gangrenosum is associated with underlying inflammatory disorder, and it presents with this type of well-defined ulcer which is very painful, and they have undermined edges and biliaceous border. Okay, so very nice. I have seen many of you with the correct answer. Now moving ahead to the next question. Please answer this question. Again, I'll just shift the image. I'm very sorry for this. I'll just shift the image for all of you. Yes. Now please answer this question. A tourist guide in Mount Everest after one of his trips developed blister on the foot, which is not useful for his treatment. Hyperbaric oxygen, aspirin, phenylephrine or pentoxifylline. So please answer this question. I have many students with me. So if a patient is going on Everest, you should have one thing which can occur. So if you know the diagnosis, the treatment becomes very easy. Very nice. So Ramu, you are right. What about other students? Very nice. Abhishek, Swarma, Deva, Gaurav, Gamer, everybody is right for this question. So this is a case of frostbite. So whenever a patient goes to a colder environment, it can have this type of bulla which occurs because of damage to the cold. Now why there is such type of damage? This is because of persistent vasoconstriction leading to hypoxia of that particular area. So now what should be the treatment modality? We should give something or some drug which causes first vasodilatation, second which increases the oxygen supply, and third the one which causes or which decreases the tendency to form platelet aggregation. So in this option number 1, hyperbaric oxygen, yes, you will give hyperbaric oxygen to give the increased oxygen to that supply. Aspirin, yes, you will give aspirin. Why? Because aspirin will inhibit the obstruction or inhibit the platelet aggregation and will increase the flow to that area. Pentoxifylline, again it is a vasodilator, so you will give pentoxifylline. But phenylephrine will not be given because it will cause paradoxical vasoconstriction, and we do not want any vasoconstriction here. So the correct answer becomes option number 3, that is phenylephrine. So you will treat this patient, you will not treat this patient with phenylephrine, rest all will be used in the treatment of this patient. Okay, so I think this is clear. So please remember the first line treatment modality in this patient is you have to warm that place. That is very, very important. You will start the patient on anti-inflammatory. You will start the patient on the painkillers because this condition is associated with severe pain. And then you will assess the severity. If it is not that severe, you will just keep on giving anti-inflammatory as well as painkiller. If it is severe, you will add hyperbaric oxygen, aspirin and pentoxifylline, which are the vasodilators. Okay, so I think this is clear to everyone. Moving ahead to the next question. Now please answer this question. I hope you can see this image, and I think this is visible. Yes, so a child presents with sore in the mouth and a rash on the hands and feet as shown in the image below. What is the causative organism? Coxsackie virus A16, pox virus, herpes virus and human papilloma virus. Surya, they will not show Raynaud's phenomena here. This is not because of abnormal vascular tone. This is because of persistent vasoconstriction. So you will not see Raynaud's phenomena here. Okay. So very nice. I think everybody know this question. The correct answer is option number 1, that is Coxsackie virus, and it is a direct case of hand, foot and mouth disease. Okay. So hand, foot, mouth disease presents with these type of angulated vesicles present over the foot, present over the hand as well as present over the oral cavity. Okay, so please remember it is seen very, very frequently in children, and it is a communicable disease. So more than one individual in a family can be seen positive with this. Okay, so I think this is very easy question and everybody know this question. Moving ahead to the next question, the next image based question. Now I think I have to move this image because this is little bit on the left hand side. So I think now it is visible to everyone. Please answer this question for me. This is again a very important question, although it's a very easy question. A 15-year-old boy has intense itching since 1 week. On examination, there is a large circular lesion on the back. The likely diagnosis is tinea corporis, psoriasis, granuloma annulare and lichen planus. So these questions are very common nowadays in your NEET PG type question. Even in your INI-CET or your next pattern questions, you will expect these type of image based question. So you should know how does the normal or common dermatological diseases looks like. So very nice. I think everybody is correct here. Ramu, Sadaf, Weber, Dollar. The correct answer of this question is tinea corporis. This is a case of tinea corporis. Now what is tinea? It is a superficial dermatophytic infection of the stratum corneum. The classical clinical feature is you will see annular erythematous plaque. Now why it is annular? Because the consistency of the center is different from that of the periphery. You will have central clearing here and you will see extension of the plaque in the periphery. So you will have peripheral extension and you will have associated superficial scales. So please remember, this is a very classical description of a patient of tinea corporis, that is annular erythematous lesion with central clearing and extension of the plaque onto the periphery. So please give me a thumbs up if you understood this question. This is a very important question for your exam and you should know how does tinea corporis look like. Now how does psoriasis look like? Psoriasis will have thick erythematous scale and the scale will look like silver white, which is not seen in this case. Granuloma annulare will present with small papular lesions which are present in an annular pattern. So here also there will be no scales. And lichen planus, it will usually present over the flexural area which are plain topped, polygonal and purple in color associated with severe itching. Okay, very nice. Now moving ahead to the next question. So I think I have to move this picture again for you. Just a second, I'll just move this picture for you. Yes. Now please answer this question. I hope you can see this image clearly now. Okay, so a 5-year-old male had multiple hyperpigmented macules over the trunk. On rubbing the lesion with rounded end of a pen, he developed an urticarial wheal which is confined to the borders of the lesion. The most likely diagnosis is fixed drug eruption, lichen planus, urticaria pigmentosa or urticarial vasculitis. So you have to answer that which is the clinical presentation in this 5-year-old child. And please tell me what is the sign name as, which is the sign which is performed here. What is it called as? So very nice, Swarna, Deva, Dr. Ankit, Nufail. Please everybody, I want everybody to answer this question. This is an important question, an image based question. The correct answer here is option number 3. It is a classical case of urticaria pigmentosa. Now what is urticaria pigmentosa? It is an example of cutaneous mastocytosis. So what is it? You have proliferation of mastocytes which is seen in these cases, and it is the most common form of cutaneous mastocytosis which is seen in a patient or in a children. Now what happens? Because of presence of large number of mastocytes, when you rub the lesion there is sudden degranulation of the mast cell, and what happens? There is release of histamine. This release of histamine will lead to formation of urticarial wheal over that lesion, and this sign is called as Darier's sign. Okay, so Darier's sign is a classical feature of urticaria pigmentosa. Yes. Now please remember, Darier's sign is not specific to urticaria pigmentosa. We do have another dermatological disorders which presents with Darier's sign. And what are those dermatological disorders? These are juvenile xanthogranuloma, even leukemia and lymphoma, and the last one is smooth muscle hamartoma. In these conditions also you will see presence of Darier's sign. Okay. So please remember, if you see a child with this type of hyperpigmented macules over the body and on stroking the lesion there is increase in the urticarial wheals, it means that you are dealing with a case of urticaria pigmentosa. So I think this is clear to all of you. And yes, Priyanka, you are right. In case of smooth muscle hematoma, you will see pseudo-Derrier sign. And why it is called as pseudo-Derrier sign? Because of on stroking the smooth muscle there is piloerection, and that will give an appearance like that of a wheel, but that is actually a piloerection. Okay, now moving ahead to the next question. I hope you can see this question. A child scratches his hand with the pen. A red wheal appears which persists for 30 minutes. What would be the diagnosis? Atopy, contact urticaria, cold urticaria, and dermographic urticaria. So please answer this question. Yes, very nice. So please remember, it is a classical case of dermographic urticaria. Okay, what is dermographic urticaria? It is a type of physical urticaria, or we can say that it is the most common type of physical urticaria. On stroking the lesion, you will see presence of urticarial wheals over the line of stroking. This is very classical and the most common type of physical urticarias. Okay, and yes, Sadaf, in white dermographism is seen in case of the atopic dermatitis. It is not seen here. White dermographism is seen in case of atopic dermatitis. Here it is an example of physical urticaria, most common type of physical urticaria. No, this will not leave any mark. It will resolve by within 24 hours, and that is why they are evanescent. So please remember, dermographic urticaria, it fades automatically even without treatment within 24 hours. Okay, so that is a very classical feature. Now this was the last question of today's session, and I hope you have enjoyed the today's session. Now I will be coming with more such sessions in the further classes. If you like this class, we have more of such sessions on Unacademy Learning app. Please download Unacademy Learning app, and you can just access on just download the Unacademy Learning app and you can see all my classes there. Okay, so good night all of you. We'll meet again on the next YouTube session. And right now at 8:30 I'm having a next pattern question session on the Unacademy Learning app, so I request everyone to please join me there. Okay, so thank you, sure, if you like the classes, and good night all of you. Bye bye.